We're live on Facebook and we're live on YouTube now. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And I'm joined by Kathy this morning. Good morning, Kathy.
Good morning, everyone.
And today we're talking about mixed connective tissue disease. And some people are highly aware of it, other people are not. And we're going to be going through this relatively new diagnosis and what it may mean to you if you're searching online and you think, well, do I have an autoimmune problem? Do I have something like lupus? Do I have Sjogren syndrome? We'll try to bring some clarity to what you've been struggling with, or do you have something like Hashimoto's? So, Kathy, what questions did you have?
Well, first let's start with what is mixed connective tissue disease and why are we talking about it?
So, mixed connective tissue disease is part of what's referred to as the overlap syndromes. And so mixed connective tissue disease is basically where somebody presents and they may have fevers, they may have joint pains, they probably have Raynaud's. For those of you who don't know what Raynaud's is, that's where their hands will turn like white and purple and red, and it lots of times happens in cold temperatures. Individuals with mixed connective tissue disease will frequently have some abnormalities on their lab tests. Early on, they'll probably have something called a positive anti-nuclear antibody. Most of you would know that as the ANA test. And through time, their lab tests may become more demonstrative. They usually will develop something called an RNP antibody. And once that is present along with the other symptoms, doctors can diagnose a person as having mixed connective tissue disease. So that's kind of what it is.
When was it first discovered?
It was actually discovered in 1971 by a gentleman by the name of Dr. Sharp. And he was seeing individuals who kind of looked like they had lupus, but they didn't really have lupus. And so he started studying these individuals and he came up with this diagnostic entity, basically. And really, I think what's important, Kathy, is that for so many people out there now with all the information on autoimmune and so many individuals, and that's why we're talking about autoimmune, because you see it all over the place. I mean, it just seems like person after person after person we know is diagnosed with a thyroid problem or rheumatoid arthritis or lupus. But there are a lot of people going to doctors for years with all these symptoms, and the doctor says, yeah, you may have something, you may be autoimmune. Well, what does that really mean to you as a patient? What is your doctor thinking? The reality is that it's like a spectrum. So here's a cup, and here's a chapstick. Over here is lupus. Over here is something called an undifferentiated connective tissue disease. And so over here, these are people who may just have a positive anti-nuclear antibody. They may have cold intolerance. They may have arthritis on this end of the spectrum. But the only thing that's showing up in their labs is a positive anti-nuclear antibody. They have shown that about 34% of people over here, they did a massive study, like 665 people, which is pretty big for something like this. And they track them through time. And if you are one of these people who kind of have like a fibromyalgia-like presentation, but you have a positive anti-nuclear antibody, and throw in there if you do have Raynaud syndrome, you have a 34% probability of developing something over here. Over here could be lupus, it could be rheumatoid arthritis, it could be Sjogren syndrome. Sjogren's is where the immune system attacks the lacrimal ducts and the submandibular glands. So people develop really dry mouth. They don't lacrimate, so they don't have tears. They frequently have other symptoms of fatigue. They may have arthralgias. So anyways, the point is you can go from an undifferentiated connective tissue disease to a mixed connective tissue disease, which is actually considered more severe once somebody develops the RNP antibodies, or it can then go into something like full-blown lupus, scleroderma, those diseases. So when I'm throwing out those terms, Kathy, are those familiar? Do you think I need to elaborate more on what each of these diseases are? Do you think
the one that kind of threw me was the gland stuff, the Sjogren's, because I'm not familiar with that. And what does it do to the glands? What would someone be looking for if they thought that was something that was going on?
Really, what the person would be looking for is if they had basically a really dry mouth and dry eyes. Those are the cardinal features. So you hear a lot of people talk about dry eyes. If you have really dry eyes, you need to think about Sjogren's. Actually, if you have moderately dry eyes, I would recommend that you get tested, because we picked it up a lot in people, or you may be in the early stages of it. So that's what Sjogren's is. And it's because the immune system, just with any autoimmune disease, the immune system is attacking our own body. If you have Hashimoto's, if you have diabetes type 1, the immune system is attacking the pancreas. Rheumatoid arthritis, your immune system is attacking specific joints, generally in the hands and other joints of the body. Well, with Sjogren's, the immune system is attacking the tear-making glands and the salivary glands primarily, and then there's a host of other inflammation throughout their body. So that's what Sjogren's is. Maybe, is scleroderma, you think, a familiar term, Kathy, for most people?
No, I don't. I never heard of it before until you mentioned it for a friend of mine. Yeah. And a little explanation on that one, I think, would be good.
Okay. So scleroderma is where individuals also have joint pain, but they tend to have really bad Raynaud's. They can have what's referred to as calcinosis. So they have like calcification of their tissues. They can have esophageal problems where their esophagus does not basically contract. They can have what's referred to as sclerodactyly. So if you ever have seen those people where their fingers are just absolutely red and blue and like they look like they're about ready to burst, that's basically sclerodactyly. And then telangiectasia, which is where you'll see like blood vessels in the eyes that are really pronounced. So that's what scleroderma is. Now, people can have scleroderma and not have all those features. In fact, it's really common not to have all of that. So that's where hopefully you're getting a picture that autoimmune diseases, it's basically, here's it in black and white, here's a diagnostic classification for this issue. And basically, if you fulfill this many criteria, then you have rheumatoid arthritis, or you have lupus, or you have scleroderma, Sjogren's, mixed connective tissue. Kind of what we're going to get at today is that it seems like they all have a similar problem. They all have an underlying problem that's akin to all of the diseases, but they have different manifestations once that all comes on. So hopefully that makes a little more sense.
It does, and I'm assuming in a lot of cases, because of everything that you've described, I mean, the doctors, are they paying enough attention, I guess, to the mixed tissue disorders, in that a lot of times you would just look and say, oh, you got rheumatoid arthritis, go to the rheumatologist. Somebody's going to run the blood work. I assume they're going to catch these pretty early, or are they paying enough attention?
I would say the patient may not feel like they're paying attention. I would say frequently the doctor is paying attention. It's just that's the other piece of it. So in the rheumatology textbooks, they'll say, well, we need to watch this person over a number of years. So we're going to watch you over 2 years and see if your undifferentiated connective tissue disease develops into mixed connective tissue disease. If you have mixed connective tissue, do you develop scleroderma, lupus, or Sjogren's? That's kind of what they're thinking. I would say more and more doctors, Kathy, I'm seeing are diagnosing mixed connective tissue disease. I would say in part, I feel it's because of the internet and the information is out there for people. So we don't have naive patients anymore. Patients are well informed, they're researching, they're asking their doctors pointed questions. I think that puts a doctor more on the spot to say, you have this, rather than we don't know what's going on. So I'm seeing many more people now come in diagnosed as having mixed connective tissue because they basically have this nebulous autoimmune condition that isn't quite lupus, but it's something. So that would be my take on it. And we have some questions here, Kathy.
Okay.
One individual said, can Raynaud's live apart from this diagnosis? And I would say absolutely yes. So Raynaud's is a common feature to most, not all, rheumatological conditions. So Raynaud's, you see it with scleroderma, you see it with mixed connective tissue, you can see it with undifferentiated connective tissue, you can see Raynaud's sometimes in lupus patients. So usually you don't see Raynaud's in something like rheumatoid arthritis. But Raynaud's, if you have Raynaud's, just know that it's probably something either neurological or it's really pointing you that there's something more autoimmune going on. If you think that you have fibromyalgia and you have Raynaud's, I would question that diagnosis because it's more it's gone another step further. And as they point out in the rheumatology textbook I like to use, they say, well, even still, fibromyalgia is not a diagnosis of exclusion. So, and it's not, but just know that it's like differing levels of immune system dysfunction that we can pick up in lab testing. I'm not saying that if you have Raynaud's and you have mixed connective tissue disease, as an example, that you're more severe than a fibromyalgia patient, because we've treated tons of fibromyalgia patients and it's an awful condition to have. But I'm just saying, if you have Raynaud's, you need to dig deeper into the lab work. And then, go ahead. And then
finish your thought.
Yeah, and then one individual said their daughter was diagnosed beginning of the year with Raynaud's. Foot got really red at times. They're getting an MRI of the brain. I'd say that's good, and keep us updated on what they find, and be tenacious in the diagnostic workup. That's my recommendation to everybody. Don't stop until you get solutions, and that's what we're really trying to do. Don't hold back on the diagnostic workup. You need to know what the problem is, and don't just accept that you have fibro or you have just a thyroid problem. Because if you think you have Hashimoto's and your fingers are turning red, there's something more going on. So,
what would they be looking for in an MRI for Raynaud?
That's a little peculiar. My only assumption would be some sort of, and I don't want to scare these individuals, but some sort of autoimmune condition would be what I would assume, affecting the brain.
Well, I've read, and I think you can give us some insight into what organs does this mixed connective tissue affect. There's got to be some other things going on there.
Yeah, mixed connective tissue, it's pretty severe, and that's what's, I don't think, quite out there yet in the lay literature. And I really want to thank the people who prompted us to talk about this, because I think it is a good topic. Because mixed connective tissue disease, it can affect the lungs. It can cause what's referred to as pulmonary hypertension. So the inflammation associated with mixed connective tissue can actually be associated with what are referred to as, I believe, endothelial cell antibodies. So the immune system inflames the blood vessels. If your blood vessels going into your lungs get inflamed, and keep in mind, I don't know if any of you have ever seen it, but like imaging of the vasculature coming from the lungs back into the heart and from the heart into the lungs is pretty elaborate. And so if you get inflammation in that arterial tree, so to speak, then that can result in a lot of pressure being pushed back on the heart, which can then result in the heart enlarging. You can get a ventricular hypertrophy. So that's a big deal. Also, the kidneys, there was some question, can the kidneys be affected? Some people say yay, some people say no. I think it's around 25% of mixed connective tissue patients can have kidney disease. Now, for those of you who are familiar, that's a big problem with lupus. So lupus lots of times develops into nephritis or, pulmonary problems. So if you have a lot of damage to the kidneys, maybe you're thinking more along the lines of lupus, but mixed connective tissue patients can have kidney problems. Kathy, they can have gastrointestinal problems, referred to most commonly as dysmotility issues. They just don't move their food through their bowels as well as they should. They can get blood vessel issues, kind of as I was alluding to with the lung issues. There's some question about miscarriages, or what seems to be more definitive is more likelihood to maybe not become pregnant because of these problems. I believe there's also an association with antiphospholipid antibodies. Another autoimmune condition, antiphospholipid syndrome, where the immune system attacks the blood vessels. So basically, you name the condition and there can be an effect. That's basically what I'm doing.
Okay, and from what I read, corticoid steroids is pretty much what they use.
Yeah, thanks for bringing that up. Yeah, so the standard treatment at this point are corticosteroids, and a good response to corticosteroids is also a predictor of somebody having mixed connective tissue disease. So that's the medical side of it. Now, the alternative side is, and what's interesting is digging through the literature, and hopefully if you guys all get a chance, you can go back and watch what we've been talking about for, I don't know how many weeks it's been now, Kathy, at least like 4 or 5, doing autoimmune. Go back and watch those broadcasts. But we talked about lupus and the really exciting new research on a gut bacteria that everybody has, but lupus patients, it gets from their intestines into their liver, and it seems to be the triggering event for lupus. We've talked about ulcerative colitis and Crohn's disease and bacterial abnormalities in there. We touched on ankylosing spondylitis. It's an autoimmune condition affecting the spine, and how that can be associated with Klebsiella overgrowth, which is a bacteria in the gut. I can't say for certain, Kathy, one particular bacteria that's associated with mixed connective tissue disease at this point. It looks like it just hasn't been studied. It's been postulated. What I will say in our clinical experience is I've worked with mixed connective tissue disease, and the patients I've worked with who you may say are, we said, okay, well, you're a good patient based on these criteria and you're going to be compliant. These people seem to have had pretty positive results. So that goes back to
what you're saying is you work more again with the diet, cleaning everything up. The same thing we do with almost every other autoimmune disease that you work with.
Right. And that's one point that I think I'm not communicating well on right now, is that when we talk about diet, people just think, oh, diet. Well, I need to heal my gut because there's a ton of marketing out there right now for gut repair supplements. Right. And my argument is the best gut repair supplement for you is basically the diet that we put you on. We have like 9 different diets at this point in time, because it seems to be the micronutrients combined with lack of saturated fats and lack of processed carbs is your best bet at reculturing your microbiome that we know of. I'm not saying there aren't probiotics out there with efficacy. I'm not saying there's not antimicrobials out there with efficacy. We use those all at a certain point in time, but just know your foods are, in my opinion, the biggest factor in how you change your gastrointestinal tract, as well as being attentive to stress and what stress is doing to you. So we have another question here. Okay, so they're saying, thanks so much. Okay, well, best of luck to those individuals who are chasing down the Raynaud's and the diagnosis. So, okay, what did you have next, Kathy?
Really, I think we've talked about the treatment, but maybe just for the fact that we could give a comparison between what your functional approach would be to dealing with the mixed connective tissue as opposed to steroids, and how damaging they can be to other parts of the body as well. So for me, it's always a big fight, and I'm sure people get tired of me saying it, but anytime we can stay away from prescription medications, because there's always so many side effects, and everybody knows with steroids there can be a plethora of things go wrong. So kind of give us a breakdown of where you would go as opposed to the steroids.
Where we would go is that we'd want to figure out why there's an imbalance in the gut bacteria, what that imbalance in gut bacteria looks like, any other triggering events that would be breaking down the gastrointestinal lining. It's like a pipe. So whatever's breaking down the pipe, we have to figure out. Foods like gluten have been shown definitively to break down the intestinal lining. Stress hormones, when high, will break down the intestinal lining. Bacteria moving through the intestinal lining is a major problem, as we outlined for something like lupus. I even forgot to mention, Kathy, and I got to answer a question on YouTube. Somebody posted a little while ago about these things called, they're like Rho antigens, and we're finding that like the Sjogren's antibodies are due to the immune system attacking bacteria in our intestines. So it's all about figuring out what happened to the barrier integrity and why that's manifesting as autoimmune disease. So that's what we do. And then we take a person through and we, in essence, try to reculture that garden, which is their microbiome. And it takes about 3 months to make a definitive change. And we're attentive to all the factors that are playing into it. And think of the field of weeds. We're going to go and try and weed out some of the bad weeds, and we're going to try to feed the good weeds or the good plants what they like to eat, and we want a beautiful looking garden in 3 months. That's what we're doing. And it's more complicated than just going gluten-free or going off dairy or not eating meat, in my experience. The medical side,
sometimes it can be a combination of all, but through the testing that gives you a really good roadmap of where you need to go, and what, when you do your deal and you clean everybody's clean and repair the systems, what I kind of think of. By the time you take away all these foods for a little while, people, he doesn't take them away forever, but and it depends on what it is, but to kind of go back to square one, get your belly and your gut back to to almost think of it as zero, empty in your gas tank, and you're going to put in premium gas now instead of the cheap stuff,
right?
and give your body something to work with, because that cheap gas has all this other junk put in it that your car doesn't like, and it's not going to run well.
Right.
And so, I mean, your body's the same way. Food is your fuel, and that's what happens. If you've got the junky food, you're going to be feeling bad. And if anybody looks back, like you said, go back and look at our other broadcast, the autoimmune thing, you bring it up all the time, really started in the 80s. And that's really when, I mean, our fast food and our high carbs and all the bad stuff that we eat really took off like crazy. That's not the way people ate prior to that. And I'm not trying to put restaurants out of business, but and they are trying to do healthier things. But we as human beings have to make healthier choices as well. And we need to know what bad things we have been putting in there and what they've been doing to us. And this autoimmune thing, it's such a huge explosion that there has to be a reason for it. They kind of go hand in hand, I think.
I agree 100%. I agree 110% with everything you said. And I would say too, Kathy, what I'm seeing in patients is that, kind of as I alluded to with the marketing, well, go through my gut repair program and go through these 4 steps. I'm sorry, but a lot of it, and this is maybe where I'm too honest, but a lot of it is to sell more supplements. Now, clearly we use supplements, so we're part of that. But there's a lot of confusion out there, and I just see a lot of these things that I know that I've tried. And I was talking to somebody last weekend where I was like, I've tried all these things. And I basically try to figure out what works and what doesn't, because I don't want people buying 5 unnecessary supplements that are not going to produce a reaction. These conditions are hard enough to fix as is. Keep in mind, I mean, basically, if you have an autoimmune condition and you get off your steroids, your biologics, that's a medical miracle. And we're trying to produce that in our patients all the time. And sometimes that entails, I'm talking to patients every day, where we're trying one thing and then we stop it and then we try something else and we stop it and we take away these foods and we see how they do. I mean, it is that complicated. It's that nuanced, and you have to be very organized in how you approach it. And certainly there's going to be people of any condition who take a probiotic and all of a sudden, they're cured. But I'm just telling you what I've seen. I've done this for 10 years now, seen thousands of people. And so that's my take on it.
Well, what you've seen is the fact that no 2 people are alike. I mean, we all know that, but in what you do, there's nothing more true, because that supplement that maybe I take, someone else isn't going to respond well to. It's not going to give them the result they need. Or like you and I've talked about, I mean, I've had a couple, okay, this one, you said take this many, it makes me itch. Okay. And your response is, they're pretty strong, they're natural, but yes, they can have a very strong effect. But once you get it leveled out and we figure out which ones are working, and hey, we don't need that one, but this one's giving us, and sometimes the response is immediate. It's amazing to me. But again, you kind of have to go back to zero to start out so that you can know which ones are giving you the desired effect.
Exactly. And the right dosage. If you take, 1 pill of an antibiotic and it's a 10-day course, and you say, well, it didn't work. Well, yeah, it didn't work because you didn't take enough. And the same thing applies to supplements. And just because whatever comes in 500 milligram capsule doesn't mean that's the right dose for you. It may be 100 milligrams, it may be 6,000 milligrams. So that's what we're actually dealing with. So.
And I think that's hard for people to understand, because, okay, we think we're all human beings. We all eat, we all move our bowels, we do these things. And so this should all kind of be a level playing field. But as you say a million times, environment, genetics, so many different things come into play. And again, your stress factors. I mean, there's so many things that come together to produce these problems. It's going to take, several things to put it back to rights, I think.
100%. 100%. Yeah. So I think that pretty well summarizes it. Did you have any other questions, Kathy?
No, I think I have a lot more understanding of what this is now, and I thank you for it.
Yeah, absolutely. And just to recap real quick, basically, if you think you have fibromyalgia, but you have Reynaud syndrome, basically your fingers turn white, then purple, then like red, be thinking you have something a little more significant autoimmune going on. If you think you have fibromyalgia, but you have a positive anti-nuclear antibody, really question if you have an undifferentiated connective tissue disease, and have your condition watched, because you have a probability of developing this thing called mixed connective tissue disease, or something else like lupus or rheumatoid arthritis or Sjogren's. Point is, be vigilant, people, be your advocate, get a good diagnostic workup. That's something we really focus on here at Gatesway to Health. We do not hold back in trying to figure out the problem, because in actuality, if you have a functional issue, you know, we can say, oh, it's all from the gut or it's all this, but you really need a practitioner who's doing their best to try and figure out what's going on with you. And I think we try to do that. So we'll be back next week with something autoimmune. And thank you, Kathy. I appreciate it.
Thank you, everyone.
Okay. All right. We'll see you all next week. Have a good weekend. All right.